Were you told that you have arthritis in your knee or a tear in your labrum in the hip? If so, strap in, because I got a mind for you. I've had so many patients come in and tell me that their doctor told them that they have bone-on-bone arthritis. And I gotta say, every time I hear that, I want to put my head through a wall. And that's because bone-on-bone arthritis doesn't actually mean anything. Because your bones are on top of other bones. And unless they're trying to explain that your bones are fusing together because of how much irritation and how much wearing away there is, that's a different story. But I've had so many patients come in with bone-on-bone arthritis, and we completely eliminate their pain and get them to squat, to bend, to lift, and do all these things without the pain, or at the very least, very, very, very minimal pain. And it doesn't require surgery. Not for a very, very, very long time. And now to talk about your tear in the labrum. You can have a labral tear and it not be the thing that causes you pain, just like arthritis. Arthritis is also considered structural damage with irritation. You can have arthritis and it not be the cause of pain. You have to understand that when these things happen, arthritis is a gradual process. You've probably had arthritis before pain even started. You've probably, maybe, had a labral tear before the pain started. A lot of times we find these things because a pain has began and we go looking for things, right? We want to understand, is there any structural damage? And then on the scan it goes, oh, you got some arthritis, or oh, you got a labral tear. But again, that may not be the cause of your pain. And I know this because just like with people who've brought me their scans and shown me like, hey, I have arthritis, people have brought in their scans and shown me, hey, I have a labral tear. And we work around that labral tear. And just like I got people who were, not able to squat and had knee pain, and they thought presumably it was because of the arthritis, the same thing happened with those who had labral tears. We're able to get them back to doing everything they want to do without the need of surgery, injections, or any of those complex things that are going to completely alter and change their life going forward. Now look, sometimes you may need to go for that surgery. Sometimes whether it's a knee replacement because of the arthritis or a kind of a cleanup procedure of the hip for the labrum, sometimes these things are necessary. But there are so many cases where people have come in and it was completely not necessary whatsoever at all. And the reason why I want to make this video is because I want people to be a little more educated and to ask more questions of their doctor and explore different things before going to surgery. Not a lot of people want to go for surgery, and I've even heard of people going for the surgery and still having pain. And that just goes to show you that sometimes what you see on a scan is not as important as who you are as a person, what your actual issues are. And that is what we need to find out. What is your actual issue so we can take care of it appropriately. So I hope this was helpful, and I want you to place a comment for what you want me to talk about next.